Good afternoon, everyone. We're very pleased to have with us today, speaking to you from Gaza, Dr. Rik Peeperkorn, who is the World Health Organization representative in the Occupied Palestinian Territory. And he is here to talk to you about the situation, the health situation in Gaza. I believe we're going to try and pull his video up. There he is. We can all see him now. Dr. Peeperkorn, welcome. The floor is yours.
Thank you very much, and good afternoon or good morning to all of you, and greetings from Deir from Gaza. Today I want to raise a few issues. I want to discuss the today released WHO reports on injuries and rehabilitation needs in Gaza. I want to say something about the health functionality, and I want to close with medevac. So first, let's focus on injuries and rehabilitation needs in Gaza. Nearly 42,000 people in the Gaza Strip have life-changing injuries caused by the ongoing conflict, according to the WHO estimates released today in the report estimating trauma rehabilitation needs in Gaza. So that actually, you talk about 1 in 4 of these injuries. By the way, 1 in 4 of those injuries are in children. So you talk about more than 10,000 children with life-changing injuries. The life-changing injuries account for 1/4 of all reported injuries, of a total of over 167,300 people injured since October 2023. Over 5,000 people have faced amputation. Other severe injuries, the largest group is actually related to legs and arms, over 22,000, to spinal cord, over 2,000, to the brain, over 1,300, and major burns, more than 3,300, are also widespread. Further increasing the need for specialized surgical and rehabilitation services and deeply affecting patients and their families in Gaza. The report also highlights the prevalence of complex facial and eye injuries, especially amongst patients listed for medical evacuation outside Gaza, supported and managed by WHO. As new injuries mount and health needs rise, the health system teeters on the brink of collapse. Currently, less than 14, I think it's probably 12 or 13, of Gaza's 36 hospitals remain partly functional, while less than 1/3 of the pre-conflict rehabilitation services are operating, with several facing imminent closure. We'll come back to that later. None are fully functional despite the effort of WHO, the emergency medical teams, and other health partners. Gaza once had around 1,300 physiotherapists and 4,000 occupational therapists. Many have been displaced, and at least 42 have been killed from as of September 2024, according to the report. Today, 1 rehabilitation health worker is reportedly killed and 1 injured, along with other health workers in the same attack. Express our condolences to their families. Gaza has only 8 what we call prosthetists to manufacture and fit artificial limbs. Displacement, malnutrition, decrease, and the lack of assisted product mean that the true rehabilitation burden in Gaza is far greater than the figures presented in the report. So you want to stress this is an under-representation. Conflict-related injuries also carry profound mental health toll, as survivors struggle with trauma, loss, and daily survival, where psychosocial service remains scarce. Also their caregivers, their families, etc., which we often forget. Mental health and psychosocial support must be integrated and scaled up alongside rehabilitation. To ensure to care and the scale of the service, including rehabilitation, there must be urgent protection of healthcare, unhindered access to fuel and supplies, and a removal of restriction on the entry of essential medical items, including assistive devices. In the long term, of course, WHO calls for ensuring ongoing investments in sustaining and in the future rebuilding a stronger health system, including rehabilitation in Gaza. This includes linking care with mental health, making service inclusive for people with disabilities, training more specialists, and ensuring support from hospitals to community care. Some words on the situation in hospitals, and as we describe it, from wars to hellish. I just spent this afternoon, actually the whole afternoon, in Nasser Medical Complex, and which is the largest hospital currently operational, partly operational in the Gaza Strip in Khan Yunis, and completely overflowing currently with patients, because we have seen, of course, a vast increase in actually people coming from the north to the south. Estimations is that between 200,000 to 300,000 people are left in the north. So that means that almost 700,000 to 800,000 people have moved to the south. I met quite in the Nasser Medical Complex a number of senior health workers from Shifa Medical Complex, which once was the largest referral hospital in Gaza. Only when I was there, let's say 6-7 weeks ago, that hospital still had 600 patients. All trauma patients, I mean, all over the place, and we described that. So, I mean, they saw an enormous influx again in trauma patients because of the increased hostilities. Currently, Shifa has less than 40 inpatients. More than 90% of their staff have left, and the only 2 functioning units is the dialysis, and you cannot even call it a trauma ward. It's more a trauma service point. So currently 8 hospitals in Gaza City remain partially to minimum functional, serving the vulnerable population. Health services in the north of Gaza governorate are only provided through one particularly functioning medical point. At least 44 health service points went out of services between 11 and 28 of September. This includes Trantisi Pediatric Hospital, St. John's Eye Hospital, the Ministry of Health, Ophthalmic Hospital in Gaza City, and Hamad Rehabilitation Hospital, one of the few rehabilitation hospitals, all in North Gaza. In addition, 13 primary healthcare centers and 27 medical points. I already raised Shifa Medical Complex, but also when you talk about al-Ahli, which is currently minimum functional, and we now already get requests to, for example, a medevac, the last patients, the remaining patients in Ilu hospital. Actually, those are neonates, but also today we were also requested, very soon we will get the same, but we have done in the past as well, taking out the last patients and maybe some of the supplies. A total of 136 dialysis patients, representing around 50% of the estimated dialysis population of Gaza City have been displaced out of the city. Of these, 61% are currently receiving care at the hemodialysis unit of Al-Zaweda Field Hospital, where the caseload has increased by 150%. An additional 20% are being referred for hemodialysis in Al-Aqsa Hospital. We see fast declining shortages for essential items such as dressing kits, particularly gauze, but also essential post-operative wound care materials, critically impacting the ability for trauma cases, and specifically everything around blood supplies, and including the whole blood component, blood bags, etc., transfusion sets, etc. WHO has procured that, and we struggle to get it in currently, because a lot of the entries are actually closed. On Nasser, I just already said, neonatal unit functioning under catastrophic conditions. Facility was designed to accommodate 17 infants, was caring for 26 newborns, sometimes sharing 2 or 3 newborns in one incubator. Let me say the last few words on medical evacuation. So with the increasing violence, particularly as the incursion in Gaza City intensifies, medical evacuation remains a flagship WHO program. Just last Monday, we actually medevaced 180 patients and companions. Gaza health system is unable to provide specialist care of services beyond the most basic emergency treatment. 15,600 people, including 3,800 children, need to be medevaced. Since October 23, WHO supported the medevac of 7,841 patients, including 5,405 children. With the conditions worsening, what we actually are requesting consistently, and I think we get a bit more traction on this request. First, that we need many more countries to accept patients. Second, equally important, maybe even more important, is the restoration of the West Bank and East Jerusalem medical referral pathway. Over to you.
I'll now turn the floor over for questions. Yes, please. Gabriel.
Hi, Mr. Peeperkorn. This is Gabriel Zondo from Al Jazeera English. Thank you for the briefing. Can you just about the report? Is this the first time that you've been able to gather this data about life-altering injuries, or is this something that's been going on in the last 2 years or so? Thank you.
Thank you very much. No, the first report from WHO, I think we published that last year, and that was with the assistance of emergency medical teams, and it was an assessment of this from January till May 24. This report is much more extensive. It's from January 24 up till September 25, but it also uses other data sources more extensively. There's of course always limitations in the data sources, but we definitely see this as an underestimation. And the most worrying thing is that in the reports last year, which we also I think discussed with you, we had the same figure that one quarter of the injured were sustaining and would require long-term rehabilitation, lifelong rehabilitation. And we see the same trends from January up till September. So that says, but I think it says a lot about the conflict and how violent the conflict is, and the impact this conflict has. And we focused, of course, very much on everything related to trauma. I mentioned the amputations, the severe injuries to arms and legs, and the brain, spinal cord, etc. We didn't even actually, and we want to make an assessment of that too, but it is very complex. The mental health again impact, and the mental health impact overall, and that's maybe something to raise according to some of the estimations that probably currently, and that's why over 1 million people are at least distressed by mental health in Gaza. Over to you.
Thank you. In the back.
Muna Abdul from Al-Quds Al-Arabi. Thank you very much, Doctor, for the briefing. My question is regarding Dr. Hussam Abu Safiya. 6 days ago, his lawyer was able to visit him, and he has reportedly lost significant weight. He's also suffering from untreated medical conditions. Could you please comment on what are some concrete actions your organization is taking to bring medical aid to detainees and also to vulnerable populations, malnourished children and pregnant women? Thank you very much.
WHO is, I can be very brief on that, is actually not providing medical aid to detainees. That's of course up to the in this say the Israeli government to take care of the detainees. We are of course very concerned about Dr. Hussam, and I know a bit. I know quite a bit. I mean, I've been myself in Kamal Adwan Hospital. He was the director of Kamal Adwan Hospital, a non-functional hospital at the moment. I've been there many times, and specifically around November and December in 24, and then it was under siege in December. Maybe you remember that. And I think in January, February, he was detained. So we are extremely concerned, and I think WHO has spoken out multiple times, and that we expect that he will be released. But we are not providing any direct care. I wouldn't even know how to do that, etc. That is of course up to the the government of Israel. And on the other vulnerable groups, I mean, like in Gaza, etc., yeah, we try to, as WHO, we focus on 4 pillars of assistance. So the first pillar is essential health services, and essential health services includes essential medicines and medical supplies, but it also includes support to primary health care and referral care. It includes the support of emergency medical teams, and medevac. It's all part of essential health services. Then the other second pillar is very much public health intelligence and monitoring the whole surveillance aspect, health information system, more classical WHO work. The third pillar of support is coordination. So WHO leading and coordinating the One UN in health and partners as good as possible. And the fourth pillar, which we had hoped would be the biggest pillar in 2025, was early recovery and rehabilitation and reconstruction. And unfortunately, we've been able to do some rehabilitation of primary healthcare centers and some hospitals, small rehabilitations, extensions of hospitals, Nasser, for example, an extension of Nasser Medical Complex, etc. And we have ongoing plan to extend the field hospital for the Palestinian Red Crescent Society, so we can do larger medevacs and Shifa. But that's it. Over to you.
Thank you. Frank?
Thank you for doing this briefing. Frank Uciardo from TRT World. 2 questions. First, can you break down the casualties and the deaths among women and children and men? How many women and children, and the deaths, how many were caused because of military actions by Israel, and how many died because of famine?
Thank you very much. No, I cannot break it down like that. We have, of course, the overall figures. Over 167,300 people injured, and roughly we talk now about close to 60,000 people killed. I think there has been earlier reports that among the deaths we talk about over 40% women and children. That has been, and on the injured, I just referred to that. So when you take this from this 167,300 people injured, you talk about 42,000 of them having life-changing injuries. Of them, 1/4, so that is 1/4 actually over the overall injured people in Gaza, and 1/4 of that are actually children. So then you talk about over 10,000 children with life-changing injuries. Over to you.
Thanks.
You've been there since like 2021 in your position in Gaza? You've been in Gaza since 2021?
No, I'm the WHO representative for the Occupied Palestinian Territory. So we have a team, an office in Jerusalem, in the West Bank, and now our larger team is currently in Gaza. So I'm based in Jerusalem, etc. And before the crisis, I was actually every month in Gaza, and since the crisis, actually from November, December 23, I've been every other month for 2 weeks, 3 weeks, or sometimes 4 weeks in Gaza.
What is your perspective like over the last 2 years? What has changed for you? What has gone through your heart and mind in the last 2 years of you witnessing this?
Well, before that, I was the WHO representative in Afghanistan for 7.5 years. And I've been working for more than 20, 30 years in Southern Eastern Africa. So I've gone through some as a young medical doctor, and then before that as well. So I've gone through some grim scenes, like in Southern Eastern Africa. We went through as a young doctor, through the whole HIV/AIDS epidemic, which had a massive impact, of course, I saw also the refugees coming from Rwanda over Lake Tanganyika when I was in the north of Zambia, where we had to take care. In Afghanistan, many, I would say, grim scenes, especially in Helmand, Kandahar, and Uruzgan, etc. But what I've witnessed in Gaza, I've never witnessed before. How quickly the health system in Gaza, I mean, people always say, oh, the health system was actually very poor. No, it was not that poor. I don't say it was great. I mean, in areas of some areas of non-communicable diseases, oncology, for example, they very much struggled. They needed to be referred. Before the crisis, between 50 to 100 patients were referred daily to East Jerusalem hospitals and the West Bank. But overall, the systems were working much better than you would actually imagine. The health indicators in Gaza and West Bank were actually better than a lot of the neighboring countries. And we've seen a health system disintegrating incredibly rapidly over. And I'm still actually surprised that with a partially or minimal working health system, how much is done. And that is a huge credit to the Gazan health workers and also organizations like myself and health partners, the EMTs, the emergency medical teams, which have been actually super operational. But of course, it's constantly on the brink of collapse. And maybe you recall that in this 2-year crisis, we have had many hospitals like Shifa, like Nasser Medical Complex, like Al-Ahli, like Kamal Adwan, etc., who all became non-functional. They were fully functional. Then in the south, in Rafah, we saw exactly the same. The moment a war is coming close to that area and forced evacuation takes place, even when it's announced like, oh, hospitals will be protected, etc., that's not how it works. Patients cannot leave or not attend. Health workers cannot leave or cannot actually come. We as WHO cannot bring in the supplies, etc. Electricity gets cut off very quickly. You see it from partially functional degraded to minimal functional and non-functional. And I've been part of the missions where we had to carry out the last 120 patients and 80 staff from Nasser Medical Complex in Al-Ahli and other places, Kamal Adwan, etc. What we now see, and I think is that we, every time, so it has been amazing that the hospitals like Shifa and Nasser Medical Complex, so when the military operations were over and people came back, that these hospitals within 6 to 8 weeks were again minimum to partly functional because of the health workers and the support of WHO and partners. Of course, what we see now happening in the north, and I'm very afraid that very quickly Shifa Medical Complex will be called non-functional and the other hospitals as well. And these hospitals should not, first of all, they should not be attacked. They should be protected, and the health workers as well. And we should make sure that they become again minimal, partly, and then fully functional. Over to you.
Islam.
Thank you, Doctor. Islam Dogru from Anadolu Agency. I would like to ask if you could shed a little bit light on how many WHO staff working currently at Gaza. Is it enough? And also you mentioned a little bit, but if you can elaborate on what kind of difficulties you go through every day with Israeli forces in terms of limitations and obstruction in Gaza. Thank you.
So I think we currently in Gaza, we have a team probably between 70 and 80. So that's from the international staff, they have so-called rest and recuperate. So every 4 to 5 weeks, they're out for a week or 10 days and they come back. So that's probably 15 and all the others are nationals. We recruited before the crisis. That's more interesting that we only had 26 staff and 1 international. So yeah, we quite expanded. I think probably even 80 now. We also expanded in Jerusalem and the West Bank to support these operations because we've done a lot of resource mobilization. But when I described the plan, yeah, we've been super operational actually from the start. Straight away from October, November, where I remember that our office and our warehouse in Gaza City was, they were non-functional, destroyed, and there was heavy bombardments going on. So within a couple of weeks, we had new warehouses in Khan Yunis, and it's an interesting story. If you the Khan Yunis warehouses, they were, when I was there in January 24, got a call from the IDF that we better took out our supplies there because there would be military operations. Those warehouses got destroyed. Then we had 3 warehouses in Rafah. Then you had the Rafah incursion. Again, those were destroyed. Then we moved to Deir, where we had 2, at one stage 3 warehouses. And You might have remember 21st of July, the largest warehouse got destroyed. We immediately rented another one, but it has been incredibly difficult to operate, not just for everyone, so not just for WHO, for UN and any partners. And we can provide you with an overview of the number of missions and the missions impeded and denied, etc. But it has been an ongoing struggle. We have, of course, had the blockade, etc. You've seen when there was a ceasefire, temporary ceasefire in February this year, how much actually could be done in such a short time by the UN, WHO, the UN, and partners. Over to you.
Abdul Hamid?
Thank you so much, Peeperkorn, for your briefing. We commend you for your courage and your straightforward briefing and honesty. I have a question. I mean, the Prime Minister of Israel said in the General Assembly, there is no famine in Gaza. So as an eyewitness, how you can respond to that from your experience? And if you can share with us some of the little talks you have with mothers who seeing their children dying of famine, and how do they cope with these tragedies? Thank you.
Yes, of course. The official answer I could give you, you have been briefed, I think, extensively about the IPC reports. And this, so I'm a simple medical doctor and a public health expert, but those are a whole group of experts on these areas, and we have had various IPC reports over the last year. And and I even remember very vividly in January, February 24, we also had for a while a blockade of the north. Maybe you recall that. And also we had a lot of then the food supplies very quickly dwindled, prices went up very dramatically, and we saw, of course, also looting, from the few nutrition supplies which went up north. WHO was supporting that some therapeutic feeding centers in the north, for example, in Kamal, one hospital, and patient-friendly hospital, and they visit them very often. And even then, you saw trends of very quickly increasing trends of children which were moderately malnourished, and a smaller group were severely acutely malnourished. So that was already, and we made the point then already in Gaza before this crisis, there was no child malnutrition. You talked about 0.6, 0.5% for the children which were malnourished. So it was never an issue. I remember also health workers struggled to cope with that because they didn't know how to deal with that. We had to do this kind of specific training, etc., etc. Even then, I met so often desperate mothers and children, which, if you first would have a look, you would say they're 2 years, etc., and they were actually 4 or 5 years old, etc. Desperate mothers which didn't know how to manage and what to do. Now then, and this is the problem, like the food supplies, everybody talked about food. What, of course, definitely everybody needs is diverse foods, a proper diverse food. And that has been the problem, I think, since this crisis. Way too little diverse food have come into Gaza. Now, over the last year, we saw again, and specifically again with the blockade, we saw very quickly rising malnutrition rates. It was, I think, in July, and let me say, it was suddenly, what do we talk, 40,000 children which were assessed as malnourished. Yeah, and so I've seen also personally too many in all these, what you call severe acute malnutrition centers, therapeutic feeding centers, etc. Too many children which were clearly very much malnourished. And I ask sometimes, talking to the families, like when did it start and how did it start and what could you do, and the lethargy. I mean, of course, it's always the most vulnerable groups, often female-headed households, etc., the more vulnerable families where this also happens. What we saw also of late, in the last year, we saw also a lot of pregnant and lactating women, which were malnourished. If you talk to the physicians and medical specialists in hospitals, and I've seen so many patients, I mean, severe trauma patients, they even said even the simple trauma wounds, their they didn't recover that quickly, because almost all of them had a level of malnutrition, and so they say the whole recovery process actually was very much extended. Wound infections were, of course, also a huge problem. So, yeah, we have seen too much of this, and people ask me now as well, oh, but now there's a little bit more food. Is this now going better, etc.? Just want to remind everyone, first of all, yeah, there's a bit more food. That's definitely true. Prices are still way too high for many of the families. Food is still not diverse enough. But of course, if you have a number of specifically the vulnerable groups, and the vulnerable groups in IPC report were very much marked children under 5, but the IPC report also referred to older children and elderly. Now this is in a combination with horrific water and sanitary conditions, and all of is only exacerbating that whole process. So this will also take a long time, a really long time to restore. And I think some of the affections will be permanent. Over to you.
Ibtisam.
Thank you. Hi, my name is Ibtisam Azim, Al-Arabi Al-Jadid newspaper. I have first a follow-up question regarding Palestinian medical teams in Israeli prisons. If you could, I know you talked about Dr. Hussam Abu Safi, but do you have a number and how many actually, because some did die in Israeli prisons, if you have that number too. And my question is actually about medical evacuation. If you could I talked to some people who were medically evacuated from Gaza, and some of them said to me that they needed at least a year and a half sometimes to wait until, and sometimes they got the permission and they went to the checkpoint, etc., and then they were sent back. If you could walk us through what a person who needs a medical evacuation, what do they go through, and how long in general they have to wait, and what do you say to countries like the US who didn't take, rich countries who didn't take much people? I think the US took maybe about 80 people, and now they stopped any medical evacuation. Thank you.
Hold on 1 second. One second, please. We're trying to connect your audio again.
Sorry.
Oh, okay.
Sorry.
Okay, now we got
Yeah.
you.
So on your first question, I don't have much data. There's some Ministry of Health, it's not WHO statistics. I want to stress that. And that's on health staff violations. And their statistics actually raised the point that 1,722 health workers have been killed and 361 health workers detained. We cannot say anything about the detention procedures, etc. We do not have information about that. As you know, that WHO had one of his staff detained. We're very happy that he's released, etc. And we had struggled immensely. We didn't have any information, for example, about that staff member. Now, on the medevac, that's a good point. So I think it's what we would hope to see on the medevac, that we get a more comprehensive approach. So I think it's quite an achievement. The 7,841 patients actually have been medevaced, plus their companions and caregivers. However, there's still a need to medevac, an estimated need to medevac at least 15,600 patients, of which 3,800 children. What we would like to see is, first and foremost, we want a traditional referral pathway to East Jerusalem and the West Bank hospitals to be restored, just as it used to be. Between 50 to 100 patients were referred there per day. Now, if you ask me, could they take in 15,600 patients? Not straight away, but it would be a little game changer, and we would be really speeding up the medevac. They could definitely take up thousands, and we as WHO would have plans to support those hospitals, the East Jerusalem hospitals and the West Bank hospitals as well. The second point is, of course, more countries need to open up, and I really want to recommend that, and again thank specifically the countries in the region who currently they were carried the burden. I mean, if you look at the numbers, Egypt, almost 4,000 Palestinian patients, United Arab Emirates, almost 1,500 patients, Qatar, almost 1,000 patients, Turkey, 441, Jordan, 268, recently Algeria, 136, Tunisia, 73, Oman, 56. Recently, we see a bit of a trend in the European countries. In total, that we talk about 350 patients. Mostly, I've seen it a lot with Italy, Romania, Spain, etc. UK started now. We would hope that they would also open up more and more high-income countries, specifically for the more complex cases, which maybe could not be or have more difficulty to be treated in the region. But again, we've been consistently lobbying. We've been lobbying with the Israeli authorities, but also with the member states to reopen the corridor to East Jerusalem and the West Bank. And we really welcomed, we saw in the General Assembly, was a whole group of countries, European countries, I also believe Canada and Australia and the UK, who all actually are now pushing for this idea, etc., and also offer their support for that. Over to you.
Thanks. Deshi?
Hi, Dr. Peeperkorn, Shidezhi with China Central Television. Two questions. First is a detailed one. You mentioned about a couple of weeks ago there are about 600 patients still in Shifa Hospital, and then you said there's only like a couple, less than 40 patients there. So do you know where did those patients go after they have to evacuate from the Shifa Hospital? And secondly, you mentioned that you've been you travel to Gaza every 2 or 3 weeks or half a month since the start of this new round of conflict. Can you describe what is the change you see every single time when you visit all those hospitals, Nasser Hospital, Shifa Hospital, all those hospitals? What is the change? Thank you.
Okay. So yeah, at the moment, so this is what I just got this afternoon for some of the senior health staff from Shifa, which I met at Nasser Medical Complex, and so they raised with me that because I said, how is Shifa now? I mean, is it still partly minimum functional? And they said we cannot even call it minimum functional anymore. There's a dialysis center which is still operational, and they said, well, there's a bit of an OPD for emergency, what we would call trauma stabilization point. And I said, how many inpatients? And they said, there's probably only 40 inpatients left. So most health workers have left. Where did the patients go? Well, I think initially in North Gaza, some to Al-Ahli. It seemed that around Al-Ahli hospital, there's still the biggest congregational population. So probably Al-Ahli and other places. And move to the south. We have seen many more, I said something about the dialysis patients, for example, in Zuweda. That's why also Nasser Medical Complex, they definitely got a load of patients, etc. And other areas. You see all of them, all hospitals now in the south are also completely overcrowded. What is the changes I've seen? By the way, I come to Gaza every second month. I said every second month, but that doesn't matter. The changes I've seen is there's constant changes. We have seen so many hospitals changing from partly functional and then becoming minimum functional and non-functional, and then becoming again minimum functional with all support and partly functional. We see, of course, currently a trend We started with 36 hospitals, and now we're talking about 14 hospitals. So we see a constant decreasing trends. As you know that in Rafah, for example, there were 3 operating hospitals there. None of them are functional since a long time because Rafah is a wasteland. It's a militarized zone and there's nothing there anymore. The north of Gaza, where you had Kamal Adwan Hospital, Indonesian hospital, you had al-Balah Hospital, etc., all non-functional. It's a wasteland. So you have still a few health points and hospitals in Gaza City, and then you talk about the so-called middle area, Khan Yunis and Mawassi. Yeah, we have seen this constantly changing, and also the needs constantly changing. Every time the hostilities increase, the war actually increase, you see, of course, an enormous wave in trauma. And the biggest difference was, of course, this 2 months of ceasefire, where we saw people moving back to the north. We went all the way back to the north and looking for their destroyed or partly destroyed or completely destroyed houses. But still, I was really surprised at how quickly they went there with making makeshift tents, etc. In Gaza City, how quickly shops started to be restoring, private sector came back, etc. There was some kind of economic life. People went back to Rafah. I mean, like to the places we had plans to also start rehabilitating some of those hospitals, etc. And then again, ceasefire ended, etc. Hostility resumed, etc. And all these people were driven back to a very small area around Gaza City, and then in Khan Yunis, a small part of Khan Yunis, and Mawassi, where we are currently. So we've constantly seen these changes. What surprised me most is still the resilience in the health system, because yes, I mean, we also say they are on the brink of collapse, but it's always surprising to see that it's still functional. And look at a hospital like Nasser Medical Complex. In January, February 24, WHO taking out the last 120 patients and 80 staff, non-functional hospital. And within 2 months, it was again minimal functional. And now again, it's a hospital which is addressing, I would say, almost all specializations in the partial level, with support also from fantastic emergency medical teams and NGOs. Over to you.
Thanks. Ibtisam again.
Hi, Ibtisam again. Just a quick follow-up. When you say minimal functional and partly functional, could you elaborate? And then also on visas for doctors from abroad, do you have any percentage? How many being denied now? Thank you.
No, we haven't. I don't have on the last question. I don't have the specific information. We've seen a trend in health workers and health workers that there was a higher denial rate of health workers for EMTs, but we're pushing for that, etc. There are still EMTs coming, but at the moment, for example, it's almost impossible. There's no EMT which will now actually work in Gaza City or the north. There's also very little to do. We discussed a little bit, should we still bring in some supplies? But we have to be very careful what kind of supplies we can bring in, because if there's very few medical specialists left and well, let's say health workers actually operational, etc., that is a change. We've seen definitely issues with medical workers not getting or being denied, etc. But I cannot say it's always the same, that it always has been a trend. Your other question was on, I forgot now.
If you could clarify, you said minimal functional and partly functional.
Yeah.
What does that exactly mean?
Yeah.
Thank you.
Yeah. So minimal functional for us is when there at least is an outpatient department, when there is some inpatient department at least, there is some patient care available, and of course trauma services. So this is what we heard now from the senior staff from Shifa. They said you cannot even call it minimum anymore, because we cannot even call it a proper an emergency ward. It's more a trauma stabilization point, and very little in-service care. the partially functional is that some of the departments of the specialist department, they are there. If it is obs-gynae, surgery, etc., they are all there. But it's not what they used to be. I mean, like fully functional. They can only do a certain amount of specific interventions and operations because of the lack of supplies, but also some of their medical specialists not available, some of the capacity not available, etc. Over to you.
Okay. Are there any other questions? Oh yes, Islam, one more.
Thank you, Doctor. Last question. We mostly talk about the injured Palestinians, Gazans, due to bombardment. What about the, you touched it a little bit, but what about the mental health, especially children? How do you concern about coming years, even decades, how they are going to deal with it? And are you doing anything currently about the mental issue in the Gaza?
Yeah, so we estimate that the number of people in Gaza requiring urgent mental health and psychosocial support has more than doubled. Like before the crisis, we talked about 485,000 people. 480, which was already huge for a population of 2.2 million. And that's, of course, also Gaza was very much, was a blockade. They went through a lot of escalations, etc. So we talk about that over 1 million people today, which will need some kind of support, more or less support. The services before this conflict, there were 6. Mental health was, I would say, there was one of the areas where I would say, which should be more developed. We always raised mental health and non-communicable diseases, especially, and maybe a little bit of an improvement in primary healthcare, which was needed. But still, before the conflict, there were 6 community-based mental health centers and 1 psychiatric hospital with a capacity of 30 beds. And all of those centers and the psychiatric hospital are not functioning anymore. With support, we also integrated mental health in 14 primary healthcare centers, and 4 mental health units were established in the MOH. So that's actually since the crisis. So you asked me what we do. Well, first of all, talk about essential medicines, medical supplies, including psychotropics. Make sure that they get into Gaza, which was not the easiest and took quite a bit of time. Then we try to integrate mental health, which should always be the case, into primary healthcare. Support in 14 centers and 4 mental health units were also established in the so-called general hospitals, including Nasser Medical Complex, Al-Aqsa, Indonesian, which is not functioning now anymore, and Shifa, which is also currently that part is not functioning. In addition, mental health services were provided by local NGOs. The Gaza, I think, Community Mental Health Program played a really important role before the crisis, and still, I think there, maybe you remember just last time the building, the primary healthcare center from the Palestinian Medical Relief Society and from the Gaza Community Mental Health Program was attacked and destroyed, Gaza City, just a week ago, and UNRWA did a lot as well. So in November 23, the only psychiatric hospital was bombarded and remained non-functionally. So currently, with the threat of new incursions in Gaza City, and other mental health providers have once again suspended services in the northern governorates. Now, I think we have to look at mental health. So we all, of course, want a ceasefire. We hope that somehow this plan kicks in, we get a ceasefire, and we get a road to peace. I raised today something about rehabilitation and trauma and injury rehabilitation, but we could also discuss for a long time about mental health, and mental health is part of that. And if there is finally a chance to start about early recovery and rehabilitation, that should be a really important component. And we have to do this in a different way, in a much more creative way. Not only do you have to talk about integration of mental health in every health level, so starting from primary healthcare and community level, but of course, we have to approach this in a different way at the community level with local organizations and NGOs in a complete, I would say, different way. There's an absolutely a need. I think that probably no one in Gaza is not affected by what have happened and what is currently still happening. And this is, I remember that when we just had this Nasser Medical Complex starting again, we had also an UN official, and then I was showing around, etc., and discussed with the director. And she asked as well the same question. But what about mental health? And what are you doing about mental health? And then he also made the point, which I think was really correct, is that first of all, we are all affected by mental health. But what we really need is first peace, ceasefire. We need shelter. We need regular foods, water, access to medical services, an education system which starts again, etc., in a private sector which again have a room to grow. And I think all those basics needs to be in place, but definitely on mental health, we need to address that in a massive, comprehensive, and hopefully in a very Palestinian, innovative way. Over to you.
Thank you very much. I'd like to thank Dr. Rik Peeperkorn, the World Health Organization representative in the Occupied Palestinian Territory, for his briefing. And thank you, Dr. Peeperkorn, and thank you and your colleagues for all that you do. Have a good day.
Thank you very much.
Thanks.